Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, talking about Lima Dental Associates. With us in the studio is Dr. Erik Risolvato. Good morning, Doctor.
Good morning, George.
Now, last week we started this whole series about dental implants, and you talked about the advisability of them and how they're better than just about everything else. Is there any particular age that should work for it?
Well, that's a great question, George. And you know, it may be most people's inclination to think that implants are for older people who are missing teeth or wearing dentures. But the truth is, dental implants can be for people of almost any age. In children, we really don't like to place the dental implant until after puberty, so it may be, you know, late teens, early 20s. But if you're a young person and you're missing a tooth or had a tooth knocked out, you know, dental implants can be used for pretty much anybody.
What about people with dentures? Are they candidates for implants?
Well, absolutely, George. And today we're going to focus on what implants can do for dentures. Next week we'll talk about replacing a single tooth or a couple of teeth. Right. But today, let's assume that you have dentures in your mouth. And what I'm going to show here first is a model. And if we can get a view of this model, basically what this model shows is what happens to the human jaw when the teeth have been removed over decades of time. And so what happens here over time when you pull the teeth, the body believes that it doesn't need the bone anymore. So the body will start to resorb this bone for minerals and nutrients, and as the time goes on, your dentures will become less and less and less well-fitting. And a lot of times, by the time people are in their late 70s or 80s, they've had dentures for so long, there's not enough bone there any longer to support the dentures. So we can do quite a few things, but one of the things that we'll do here on this easel is we can go into the mouth and we can place these titanium screws into the patient's jawbone under the gum, and a bar can be connected to those implants, and that bar would then be above the tissue in the mouth. Right. And then this denture then can be placed on top of this bar. And an example of that on the model is something like this. And so this denture is an in and out denture. It comes in and out of the mouth, but when it's in the mouth, it has clips inside of it. And so when this denture goes in, it stays in the mouth.
Clicks into place. So, very good, Doctor.
So, that's pretty much dentures. There's a lot of ways to deal with it, and we're going to wrap it up for today.
Okay. Any other advice?
Just keep smiling, sharing, and caring.
Thank you, Doctor.
Thank you, George.